So the next thing we're going to look at are the tendons and the muscles. So similar to the ligaments were going from bone to bone. The tendons are now going to go from muscle to bone. But they're both going to be composed of this fibrous connective tissue, and both have very little elastin. So the tendons become like an anchor for the muscle. We talked about the muscle attaching to the periosteum. The tendon is going to be what takes the muscle and attaches it to the periosteum, or that outer membrane of the bone itself. So the tendon creates that anchor, which allows it to stabilize and anchor down to the bone itself. But it doesn't have a lot of elasticity, which means that unlike the muscle tissue itself, it doesn't have that capacity to be able to stretch and really adapt as significantly as the muscle itself. So the tendon can easily be torn or overstretched. It can also be torn away from the attachment if it's significant enough. A lot of times with repetitive motions, the tendon can become irritated or inflamed. We talk about this as tendonitis, as that inflammation of the tendons themselves. So there's a lot of different reasons why tendons can become irritated. In our yoga practice, we can look at many different tendons that become irritated and different reasons why that can happen. But if we look back to the function of the tendons themselves, we see this kind of somewhat of a lack of resiliency that we see in the muscle tissue itself. The muscle tissue has this ability to contract and relax and reshape itself in many different forms that the tendon itself doesn't have. We also see, similar to the ligaments, that the tendons have very little blood supply, which also means that they heal very slowly. Similar to the ligaments, a healing time for the tendon will be much slower than if I were to injure my muscle belly itself. Now, clearly that's going to depend on the severity and the extent of the damage or irritation that's been done, but in general, the tendon is going to heal much slower than the muscle itself. We see this a lot of times in the classic yoga irritation in the hamstrings, and people who get that irritation right up at the sitting bone on the tendinous attachment of the hamstrings versus right in the center of the muscle belly, which is much less common. And in general, if I'm doing the right things to heal it and to allow it to heal, the muscle belly tears will heal much quicker than the tendinous tears will. Now, looking at the skeletal muscle itself, so the muscle belly, we already know a little bit about it because we've talked about it in relation to the tendon itself. But remember that the skeletal muscles, when we talked about the bones, create movement by pulling on the lever arms of the bones. So we see this attachment and where and how they attach on the bone is really significant to the action of the muscle. So when we look at the anatomy, when we look at the muscles specifically, we'll talk about the origins and insertions of where it attaches on the bone, not so much for you to memorize, but for you to kind of get a picture of how the muscles pull on the bones. And you can think of this like puppet strings. Our muscles become kind of puppet strings to pulling on the bones in different articulations to allow for different movements and all of these coordinated movements of the body as a result of all of those muscles working together. But the muscles, in conjunction or in comparison to the tendons and the ligaments, are highly elastic. They have a lot of blood flow. They've got a lot of circulation, so the muscle tissue itself tends to recover a lot faster than the tendons and the ligaments. The muscles also become a really important supportive component to the joints themselves and to the ligaments. We talked about the ligaments surrounding the joints as being kind of these passive stabilizing mechanism to keeping that integrity of the joint, that stability of the joint, whereas the muscles become a component of that as well that we can directly intervene in. So we have the passive stability of the ligaments that we can't really tell it what to do. We can't tell our ligaments to contract or our ligaments to support us, but we have this passive element of stability of the muscles and the tendons superficial to that, which we can control. So we have what I like to call of the active stabilizers of the muscles and tendons, and then the passive stabilizers of the ligaments, the capsule, the cartilage, and the bone that's already kind of set to some extent. That's already to some extent predetermined. Now, when we look at this balance within the bone, within the muscles themselves of, again, similar to what we talked about already, this balance of mobility versus stability, that ability to not only allow for movement, but also create stability and integrity in the joints. You can imagine if I didn't have any cohesiveness, any stability, my joint would just be kind of flopping around in the socket to some extent. There's not a huge amount of movement, but you can imagine if the soft tissues weren't holding this joint together, there'd be a lot more movement inside of the joint, which also means that there's more friction, more wear and tear, and increases or it starts to speed up that degenerative process. So there's this balance, again, with the musculature of being able to have that middle path of allowing the muscles to be strong and supportive, but also to still allow for that mobility to allow us to go through the movements of our lives. And this balance of strength and also the tone of the muscles and the balanced tone around it really creates efficient movement. That balance of mobility and stability to allow us to move efficiently to help prevent injury. So there's two different things here we're looking at balance between. One is the strength and mobility. So the ability of the muscles to turn on and support and to turn off to allow for range of motion. But also think of this in a three-dimensional sense, the balance of the tissues around the joint. And I like to think of this like a trampoline. If you can imagine a trampoline has these springs that are pulling all the way around it here. And they all have to pull equally to some extent to keep that equalized pressure on the platform that you're jumping on in the middle, right? You wouldn't want to fall down on one side. You want to have that equal pressure around it. So what we're looking at here in a three-dimensional sense is the same thing with the joints. It's not so much about one muscle being strong, but about the trampoline effect, three-dimensionally, of the muscles being somewhat equal in tone around the joint to help create that stability and integrity in the joint. And understanding just that concept, I think, is really helpful as a yoga teacher, understanding that the health of the joints isn't so much directly related to our ability to have a large amount of strength or a large amount of flexibility. In fact, I might be really flexible in one range of motion and really tight in another, which might not be as good of a scenario as if I was just kind of tight all the way around the joint. Again, if I imagine that trampoline scenario, I can kind of picture how and why that might be really important for the joint of the bony structures that we talked about in the past lectures and all of those more passive layers underneath it of the cartilage, the capsule, the ligaments. Now, the other thing that's really helpful, I think, to consider is if you come back to this trampoline scenario, is if you think about it, right, if I were to cut away some of those springs on one side, right, if I were to detach some of them, you can imagine the force shifting away from them. Right, I've got this trampoline, all these springs pulling. I cut away maybe 6 or 7 on one side, and that force starts to shift away from the springs. Now, I could go over to the springs on the other side that have now shortened and try and stretch them out, and stretch them out, and stretch them out, and stretch them out. But clearly, it makes sense to us that me stretching those springs of the trampoline is never going to change anything until I reconnect the springs on the other side. And this is really helpful to think of this balance of strength and flexibility, because I can keep stretching things that are tight until I'm blue in the face, but until I find this balance of strength and support and mobility, both in one muscle as well as around the joint, I'm not going to be as efficient and effective with my movements as I could if I just focus on finding balance. And that's really important not only for how efficiently we move, but also really importantly for the deeper layers of the joints. We talked about already with the cartilage not really having a voice of its own, not really being able to speak up because it doesn't have that direct nerve innervation. So our ability to really feel and sense what's happening in the cartilage is very limited. So in order to think about this integrity of the deeper structure of the joints, it's harder to go by just what we feel and more important to go by finding this sense of balance. Looking for ways in our yoga practice, the things that are really easy maybe aren't the things we need to work on as much as the areas that are tight or maybe the areas that are weak that we struggle with, so that we don't have to overthink that scenario, but in just understanding these layers of the joint and that trampoline kind of analogy, that you can see how just finding balance is really a key part of the practice. So when we look at the skeletal muscle, what we're going to talk about within the anatomy is some of the primary motions of each muscle. Now, the reality is that each muscle has different muscle fibers, which contract in slightly different ways. That it's not necessarily that straightforward, especially when we look at some of the larger muscles. That some muscle fibers might be able to contribute to different ranges of motion. For our purposes, though, we're going to focus on the simple, straightforward main actions of each muscle. But just know that different muscle fibers of each muscle can contract in different ways, in slightly different ways, which allow for us to have this precision in our movement, this refined kind of not only very subtle movements, but also coordinated movements of the muscles working together, so that the body never moves as separated parts, but as a coordinated whole. Now, the contraction of the muscles, one last thing to mention as we kind of look at how this relates to how we live and breathe in our bodies. We also want to remember that the contraction of the muscles is also really important for the circulation to help move blood back to the heart. It helps to draw this venous return, the blood in the veins returning back to the heart. It also helps to move lymphatic fluids through the body, through the tissues. So it has a really important purpose, even if we're just thinking about these muscular contractions circulating blood and lymphatic fluids, a really important, significant effect on the body as well. The other side, the flip side, the negative side, is that when we have chronic contraction of the muscles, when they become tight chronically, the kind of the clear one most of us connect to is that chronic tension in the traps, especially if you tend to sit at a desk all day, is that chronic low-grade tension. It might not be here, right? Most of us don't sit around here, but it might just be a little bit of that low-grade chronic contraction, just enough to help to decrease the circulation to the tissues. Some of that tension in the muscles helps to limit the circulation to the tissues, can also create inflammation in the tissues. Both of these can create what we call hypoxia, which is a lack of oxygen, which means that the muscle is not able to perform a lot of its functions as efficiently as it could. And also fibrosis, which is a buildup of fibrous tissue, which is similar to scar tissue. Many of us think of scar tissue as kind of having maybe a surgery or maybe a cut where we actually see the scar tissue itself, but scar tissue can really be referred to as any bit of this fibrous tissue that builds up in the body that creates significant limitations. So when we look at this, there can be fibrous tissue building up, there can be lack of oxygen, but it creates a cycle that makes it harder for the muscle to recover as well. So ideally, what we want to think about in the muscle tissue is kind of this plump, supple tissue that's able to not only contract, but also to relax, to allow for this range of motion, so that if you were to imagine my muscle here, it's able to contract fully and shorten in order to perform its function, in order to support us in whatever way that is, and able to relax and re-lengthen to allow for our mobility. And when we get stuck somewhere in between, you can imagine if I had chronic tension just partially, it's also potentially going to be limiting that capacity to contract and relax. So I want to be able to have this pliability. I like to think of, like, if you've ever seen a sprinter's quadriceps, there's like this suppleness, this juiciness to the skeletal muscle that is really meant to be able to contract and relax and have this good perfusion and circulation of the tissues that allows it to become oxygenated and refueled very simply, very easily, rather than this chronic tension that potentially limits that turnover of the tissues as well. So let's talk about a few different types of contraction. I think it's helpful just to understand that the way that the muscle contracts can be very different. The first one is a concentric contraction. A concentric contraction is basically what you think of anytime you contract a muscle. When I contract my biceps, when I lift a weight, I'm concentrically contracting the muscle, meaning that it's shortening as I contract it. Not a term we use very much, because usually we just think of that as the normal function of the muscles. So think about that as you maybe lift something in your hand. Think about that, the deltoids concentrically contracting or shortening as I lift my arm up into warrior B. The next one we're going to talk about is eccentric contractions, which is going to be basically the opposite. So this is going to be happening anytime a muscle is contracting as it's lengthening. So think about this as you come into warrior B, your quadriceps are going to be lengthening anytime you bend your knee. So if I were to come into warrior B and bend down into my bent knee position, my quadriceps are going to be lengthening, but they're also engaging. We're all pretty aware of that engagement in warrior B. Usually for most of us, it's one of the first things to get tired if you stay in warrior B long enough. It's clearly activating to keep us from falling on the ground, but it's also stretching to some extent as we go from a straight leg to a bent knee. Another clear example of this is in chaturanga. As I lower down into chaturanga, my triceps are contracting to keep me from falling on my face. If my triceps didn't eccentrically contract, I would just fall onto the floor. So they're limiting that motion, they're lengthening, but they're also contracting to keep me from falling down. So they create these coordinated movements to help balance the body as I come in and out of a lot of the transitions of my practice. The last one is isometric contractions, and these are happening anytime you're holding a pose. So these are when the muscle is contracting and working without creating movement. So if I come into triangle pose and I stay there, there's a lot of muscles, ideally, that are gently isometrically contracting to keep me in that shape. As you're aware of, if you were to stay in triangle pose long enough, at some point you'd get tired, and that might be a little bit different depending on each person, or maybe depending on the cues or the things that you were paying attention to, but that clearly you would get tired at some point. So those muscles are isometrically contracting to keep you in the pose statically. The last couple of terms that we want to think about that we'll be using when we talk about the anatomy is agonist, antagonist, and synergist. Agonist is going to be the muscle that's moving, and we won't use that term as much. But the antagonist is going to be opposing the agonist. So if I'm doing this bicep curl again, it's an easy one to consider. My bicep is going to be the agonist, creating this flexion of the elbow. The antagonist to this is going to be the opposite. It's going to be my triceps on the opposite side will be the antagonist. And my synergist would be other muscles that are working with it, which we could think of maybe the brachialis, which we won't talk about, but there's always synergistic muscles. There's rarely only one muscle that does a job. So when we look at this, we've got the primary muscle that's moving, the agonist, the antagonist doing the opposite motion. So as my bicep flexes, my tricep will extend the elbow. So the opposing muscle group will be the antagonist, and the synergist will be the other helpers that do the same action as the agonist. That concludes your intro there. I'll see you next time. Enjoy.